So here I'm going to discuss about age-specific nursing care. The purpose of age-specific consideration in patient care is to provide the healthcare professionals with information about different age groups, how to identify the need related to these age groups, and how to vary approach to the patient care with a specific need in mind. So NCLEX board sometimes asks the question about the age-specific nursing care. In this group of discussion, we categorized the age group according to age group 1 to 12, age group 13 to 18, age group 19 to 40, age group 40 to 60. And also age group 60 up. No matter the age, all patients have a same right for them for the treatment. What it is? The same right for safety, confidentialities, means we never share the patient information with others. It is the patient right to get the pain management, control, comfortness, and also involved of the family member or others they like most in their care, and also maintaining the privacy. In this table, we can see the different age groups and also health risk consideration in particular age groups, and also development and communication consideration. Let me read in this table first. In case of pediatrics, it is subcategorized infant 1 year and under, then second group 1 to 5 we call preschooler, school age group 6 to 12. But we in this note we are going to explain age group 1 to 12. Second, adolescents 13 to 18 age group, adult, young adult 19 to 40, middle age group 40 to 60, and another last age group is 60 up. In case of pediatrics, if the baby up to 1 year, the health risk factor, temperature regulation, and risks for dehydration or risks for choking. So it is the life-threatening condition. So if patient have a high fever, the management of the temperature is the first priorities. Prevent dehydration, and also we be concerned about any stuff because baby like to put everything in their mouth, chance to develop choking, right? In this age group, also patient or children are mistrust to stranger and keep the parents in views. They want to see their parents all the time, right? And here, preschooler 1 to 5, the risk factor, accident injuries or infection. So most priority, prevent accident or infection. So impulsive and concrete thinking. So what they're thinking, it is very rigid. Also, avoid the separation for parents. It is the fear. And use the play to teach. The school age group 6 to 12. The risk condition, accident prevention, the chance of accidental injuries. In this group, we give them the choice, what they like, also explanation, and also use the game and play to teach. Let me talk about overall the age group 1 to 12. In these age groups, the top two nursing concerned are medication error. Particularly in this age group, the chance to develop medication error. Pediatrics patients are 3 times more likely to have a chance of medication error. Also, the complication develop from intravenous therapy. So now question comes, how we can prevent the medication error? So before administering the medication, ask the client or ask the parents, ask the client's parents for patient name, check their bracelet, and also date of birth. If the patient is too young, position properly before oral medication and feeding due to risks of aspiration. The age group 1 to 12, number one fear to the children, separation from their primary caregiver. So for the pediatrics, who is the primary caregiver? Parents. So they have a fear if they go away. And also the number one fear for adult, public speaking. So now go adolescents, age group 13 to 18. In this age group, our goals, development, and helps them. Development, the relationship with opposite sex. And we help them to cope with body change because it's the adolescence change, puberty time. Also helps them to establish a healthy sexual relationship. They need to establish independence from primary caregiver. In this age group, the patient priority concerned in case of female menarche, the first time start menstruation period, and in case of men, acne developed. What else? What are the psychiatric priorities? Adolescents, 13 to 18 age group, patient chance to develop the depression. Because of depression, it leads to suicide. So suicide is a prevalence cause of death in this age group. So the most priority is safety, most priority to prevent the suicide, to give the space to verbalize their feelings. What else? In this box, we wrote the health risks consideration, suicide risks, consider sexual development in older adolescents, substance abuse, sexual activities, and also provide the privacy. So in this age group, they are most interested about the opposite sex. So development relationship with the opposite sex is important. We help them to establish healthy sexual relationships. So education is important. Peer relationship importance, also respect the privacy. What else? The next group here, it is age group 19 to 40, right? So in this age group, number one priority, the self actualization or acceptance. Establish the social relationship is most important. Also, in this age group, they are concerned or they're looking for or they think about how to going to manage their children if they sick. They think about this, they're concerned about their families. And psychiatry priority in this age group, overcome the barriers to learning. It is hard to overcome the barriers of learning. What wrote here in this age group, disease prevention. In this age group, the health risk condition is disease prevention and pregnancy. Also, assessment, level of development, child care important, and also work responsibilities. Because in this age group, they start to their family, they have a kids, and also they have a job responsibilities. The next age group, middle age, 40 to 60, right? So in this age group, concerned is the first important concern is to identify the disease or risk factor of disease. So if you identify your disease, if you identify the risk factor of disease, you can prevent the disease progress. So identify the risk factor is most priorities. The best way to anticipate the disease is to look at hypertension or hyperlipidemia. So if patient know they are hypertensive, they can take the anti-hypertensive medication and prevent heart failure. So most priority to find out the risk factor. So I can put a star here. Let me explain second page here. So the community health nursing, there are 3 levels of prevention. So in the age group 40 to 60, number one concerned to identify the disease prevention or risk factor. This risk factor we categorized in the 3 levels: primary prevention, secondary prevention, and tertiary prevention. Primary prevention, reduction of risk factors before occurring of the disease or condition. So how do you have to reduce the risk factor? Just find out the risk factor. So important to scanning, right? Example of primary prevention are like immunization or cleaning the environment, sanitization, right? Like a patient drink enough water. It can prevent it can helps to expel out the waste product and prevention of the disease. Secondary prevention, early detect of potential for development of a disease or condition or existence of the disease while asymptomatic. So secondary prevention, it is the early recognition of the disease and then we try to prevent it. Like if a patient diagnosed hypertension or diabetic, they took medication like insulin for diabetic, it is the secondary prevention. HIV scanning is a secondary method. Benign enlargement of prostate scanning, secondary prevention. Tertiary prevention, treatment of a existent symptomatic disease process. So you stop to lead the odds. Tertiary prevention, like dietary measurement, nutrition, also tertiary prevention, or containing the disease, physical therapy after the stroke, it is the tertiary prevention. Dietary measurement for HIV or AIDS, tertiary prevention, right? So let me go back. What we wrote here, 40 to 60, chronic health problem and age-related change develop. It is a risk factor. And what we could do, struggling with dependence, care for the children and parents, because they're in between. They have a parents, they have a children, they're concerned about this. So the age group 40 to 60, the psychic concerned, they think about their caring for children and parents at the same time. They stuck in between parents and children, in between two generations. The age group 60 up, what is the most important here? In this age group, our target, maintaining the physical abilities, prevent the cognitive declines, and positive grips the loss of spouse or jobs. What wrote here is 65 plus up. The chronic health problem, age-related change to the skin, bones, and cognition. It is very hard to cope with change the body. Highest portion of inpatients experience the loss of support and independence, also frustration and depression. As I told you, in this age group, our set of target, maintaining physical abilities, prevent the cognitive declining, and also positive grips the loss of spouse or a jobs. But how we can do this? And what are the NCLEX board asked the question? In this age group 60 up, and as I told you, the NCLEX board asks question about here, how we can do or how we get that target. Number one, in this age group, medication safety important, prevention of fall is important, and also we have to concerned about the skin breakdown. How can we stop it? Number one, medication safety. Elderly patient, their metabolism is lower, and also they have a high body mass index. BMI is high, fat is higher, in percentage of the body fat is high, also less the percentage of muscle mass. In that condition, they have a chance of develop medication error, and medication does not expel out from the body. So medication toxicity is important. So it is nursing concerned proper measurement of doses, and also to check the blood level of drugs. If patient need to take digoxin, digoxin has a narrow therapeutic index. We have to check the blood digoxin level. And before start the digoxin, we must need to check the pulse rate. So medication safety is the most priorities. What else? Second, in this age group, 95% accident occur because of fall. So prevention fall is most important. So how we can prevent the falling? The way of prevention, communication, good communication. When patient needs something, give them or tell them to push the call light, you will be there. It is the way of communication. If patient has a difficulty of hearing, give them appropriate hearing aid. If patient has a visual impairment, help or assist them. If patient have pain, addressing pain and pain management is important. Because of pain, they are under anxiety, they try to do something by themselves and they fall. So addressing pain and management of pain is important to prevent the fall. What are the other different way we can prevention the fall? Like patient bed, it should be lowest position. Bowel training, bladder training. This program can prevent the fall. So every 2 hours, they have to go for bladder training or bowel training program can prevent the fall. Every 2 hours, they should go. Also, non-skid shocks can prevent the fall as well. Last one here, skin breakdown. Because it is more common in age group 60 up, and if you do not know how to check the skin breakdown, it leads to develop the ulcer formation, more complicated. So skin breakdown, we have to go for assessment first. So if the patient nutritional status is poor, they have chance to develop skin breakdown faster. If patient lie down on bed in the same position for a long time, chance to develop skin breakdown. So immobilization, one of the cause of skin breakdown. So as a health provider, we have to train them, we have to assist them to ambulation, right? Movement. And also restraint. Some medical conditions, some patient need to put the restraint. So if you put the restraint, it is important to regular checkup, right? And also what type of restraint we put, very important to know. So we must know type of restraint, reason of the restraint, location of the restraint, and duration of the restraint. Right? So this is the way we can prevent the screen breakdown.